Even if you don't believe it, a knee pain could indicate that your varicose veins are going to deform. Little by little, as we grow older, our knees can start to ache, and they might hurt for very obvious reasons or perhaps for reasons that are not so apparent. A change in your blood circulation, the appearance of varicose veins in your legs, the decalcification of your bones, or perhaps even the degeneration of your cartilage, your collagen, or your skin. In the video, I will reveal the most important causes of knee pain so you can be aware, know when it happens, and understand exactly what is happening. A warm greeting to everyone from Dr. Agustin Landivar, naturopath, acupuncturist, conventional doctor, and founder of drlandivar.com. On this channel, as a conventional doctor, I treat my patients through natural medicine, homeopathy, and acupuncture before resorting to the use of pharmaceutical drugs. So if you're new to the channel, please consider subscribing and hit that little bell icon down below to make sure you get notifications and be the first to watch our newest video. If you need an online consultation or quality supplements for your condition, visit drlandivar.com and stay until the end of the video to see more tips and related videos on this topic. Our knees, however incredible it may seem, are truly intricate and complex joints. It is through them that all the body's circulation passes down to the feet. It is precisely there where veins, arteries, cartilage, movement, and the entire weight of the human body are concentrated. Even if you don't believe it, our knees support the largest amount of weight in our entire organism. And if they are not functioning exactly as they should be, and they are beginning to cause you pain, then you must really pay close attention because something serious could be happening. So in this video, I'm going to talk about what are the most important causes of knee pain so that you can know them, reverse them, and make sure of what is exactly happening. Before continuing, don't forget to like the video and visit the page drlandivar.com. There you'll find knee supplements such as Finley's Extra Flex, collagen, which besides being for your knees also benefits your skin, enhances your beauty, aids rejuvenation, and keeps your whole body healthy. So with that said, don't forget to like this video and then let's continue. Number 1, the appearance of varicose veins. It might seem hard to believe, but our very own knees can actually give us a sign of when those varicose veins are about to make their appearance. Those unsightly bulging veins, perhaps a shade of blue, red, or even a deep lilac hue that emerge in a winding, unpleasant way, and which many times we ourselves simply don't want to look at, can actually be the underlying cause of that persistent knee pain. Believe it or not, all the blood circulation that flows through our legs concentrates in our knees, especially at the back, precisely where we bend that joint and where we find that all the circulation must converge to be able to pass and ascend towards the upper parts of our body. If you experience knee pain and it bothers you in an unusual way, perhaps not directly in the bone, but in a manner you identify as related to circulation, then be cautious, because it might indicate that varicose veins are beginning to form, or perhaps you already have them, even visibly prominent and fully developed. On any occasion, it is extremely important to be able to exercise the body, not to stand for a long time, to make sure to take a supplement to improve circulation and so that those varicose veins do not keep appearing. If you decide to do nothing, those varicose veins will grow. The walls of the veins and arteries will widen. They might eventually rupture, and then you will definitely need surgical treatment, an emergency, or an urgent procedure because you'll obviously lose blood from that very vein that you refused to treat when it was the right time. If you need a quality supplement to improve circulation and recover your legs affected by varicose veins, look for Finley's Vein Flow at drlandivar.com. Number 2, it could be decalcification of the knees. If your knees hurt, it could be that you are experiencing an inflammation problem, or above all else, and this is often much more common, a problem of bone decalcification. We often forget that 4 important bones come together in our knees: the femur, which is located at the top, the tibia, and fibula, found in the lower part, and a small bone that is more or less loosely positioned in between, which is called the kneecap. In this particular case, bone decalcification can begin to be felt in the knees, and it's specifically felt there because the entire weight of the body, whether a person weighs 100, 200, or even 300 kilograms, all of it eventually reaches the knee. That's where the body has to bear all the weight to exercise, move, walk, and perform necessary daily activities. And that's where the problem begins if you don't have good ossification, good calcification, and obviously good joint movement. So if your knees are aching, begin taking supplements for your bones. Take calcium, take magnesium, take various vitamins, boron, silicon, vitamin K, and so on, vitamin C, everything that is essential for them. Because if you don't help them, no one else will, and obviously your bones will only continue to deteriorate. If you find yourself needing a high-quality bone supplement, especially once you've reached your 30s or 40s, and to address bone decalcification and obviously to help restore that vital function, then make sure to look for Bone Ultra and Extra Flex by Finley, available at drlandivar.com. Number 3, arthritis or inflammation is still more common, and it may happen often that bones crack when joint inflammation occurs. Arthritis or osteoarthritis may be appearing, which is often more frequent for that cracking to occur. If you're feeling that every single movement you make produces a crunching sound, crack, grind, it comes and goes and you have no idea what the cause might be, it could very well be an inflammation or even osteoarthritis that is quite obviously in the process of developing. In that case, you have to do everything possible to give your body the necessary ingredients to be able to reverse the situation so that it can rebuild the cartilage, ensure that it can function, ensure that your knee can activate, regenerate, and be able to reduce inflammation, above all, because that was the primary cause of the situation you are in now. So if you're experiencing knee pain, and at the same time you're also suffering from joint pain with sounds when you move, and especially if that pain feels much worse in the morning right after you wake up, it's very possible that what you might be experiencing is arthritis, or perhaps osteoarthritis and inflammation. For this, you'll need an anti-inflammatory, something like Final's Curcu Health, a reconstructor for your cartilage, such as Extra Flex and collagen. And obviously, you must change your diet because if you continue eating junk food, you'll never again be able to recover anything in your body without suffering from inflammation. Number 4. A tendinitis or muscle injury. Tendinitis, as its name implies, in this case an inflamed tendon, tendinitis, is precisely a condition where the tendons that hold the knee, which support the bones, muscles, and cartilages in their place, become inflamed due to a blow, an injury, or some entity or substance that has accumulated in the body. Similarly, a muscle injury resulting from an awkward movement, an incorrect rotation, or a direct impact can also lead to muscle inflammation, which in turn causes significant knee pain. This particular situation is somewhat more complex and delicate, as these are specific parts of the knee that quite obviously tend to have a greater challenge in terms of recovery and healing. You need rest, you need some kind of anti-inflammatory, you need something natural to change your diet once again, and make sure to visit your doctor to see that there isn't a lesion in those tendons, which, by the way, are very difficult to heal. If you have knee pain in any form, you must do everything possible to get yourself checked out. Don't let yourself think you have something that it's not, and in the end it turns out to be something that doesn't work for you, and the damage keeps progressing to a point where truly you can no longer fix it. And don't forget to subscribe to the channel, sharing it with your friends and family so they can be informed about the topic. If you have any doubts or questions, leave your comment below and I'll gladly answer it. If you need quality supplements for your condition or an online consultation, visit drlandivar.com. And right here you'll find all the topics, valuable information that can help prevent serious illness in the future. We'd like to thank you for attending, and we hope to see you again soon.